So what are the clinical features of tonsillitis? So initially a tonsillitis and pharyngitis, initially it starts as a sore throat. Sudden onset of a sore throat, there will be pain and discomfort when the kid is trying to swallow. Most of the instances we do have a fever also. You examine the child and you will, many examination findings are positive in the oral cavity. So first, you will see that the posterior pharyngeal wall, the tonsillar pillars, the soft palate, everything has an erythema. There will be edematous exudates will be seen. Small enanthems can also be seen. And when you examine the lymph nodes, the cervical lymphadenopathy will be there. That is actually lymphadenitis. So when you palpate for lymph nodes, they are very, very tender. Many ulcers can be seen in Coxsackie virus, that is hand, foot, mouth disease. You see a lot of ulcers in the inner surface of the cheeks, in the hard palate, soft palate, under surface of the tongue, even on the tongue, etc. When viral illnesses like EBV, which causes sore throat, it can be a systemic involvement, like it can cause a hepatosplenomegaly. Group A streptococcal involvement, which causes a scarlet fever, a complete presentation of a scarlet fever will have a rash. So we know the typical rash of a scarlet fever will be a sandpaper-like rash, more prominent in the creases. Okay, more prominent in the creases. The child will have a flushed face with a perioral pallor. Okay, so this is the most common seen in the group A streptococcal scarlet fever. So mostly the children are well children. They have a fever, they have some discomfort while swallowing, but red flags are minimal. If you find any of these red flags, then admit the child. Think of an alternate diagnosis in some situations. I will tell you when. So first, if the child has an unwell or toxic appearance, not able to drink, eat anything, please admit the child and evaluate. Respiratory distress is present, a stridor is present, a trismus. Okay, trismus is inability to swallow and move the neck here and there, and drooling of saliva, a red potato, a hot potato voice, torticollis, neck stiffness, neck fullness. So all these indicate that it is not a simple acute pharyngitis or an acute tonsillitis. It might be a complication of this pharyngotonsillitis, like maybe there is the extension of the infection to a parapharyngeal space or a retropharyngeal space, or it has already formed an abscess, or in case if you see a stridor, if you have a muffled voice, we have to definitely think of epiglottitis. Although this age, like beyond 5 years, not very common, but still think of epiglottitis, viral infections like a croup also when there is a typical stridor, neck stiffness, neck fullness, even think of meningitis when there is a high grade fever. Okay, so all these are red flags. When you find any of these, think of alternate diagnosis or think of complications of acute pharyngotonsillitis. Okay, so what are the complications of an acute pharyngotonsillitis? So I have mentioned few of the complications just now, right? So what are the other complications we will see? So the complications you can divide as either it can be a local suppurative complication or it could be a non-suppurative illnesses. So a local suppurative complication is from the pharyngeal point of view or from the tonsillar point of view, it is extending around those areas. So I told you it can extend into the parapharyngeal space or it can extend behind the airways in the retropharyngeal space. So both these are very, very notorious spaces where all these lymph nodes are interlinked, and parapharyngeal space has this carotid arteries, IJVs, a lot of lymph nodes, subcutaneous fats, areolar tissue, etc. So these communicate each other, the infection spread very quickly, they can cause compression of these vital structures. So a high index of suspicion is needed to when you think of these infections, and a very, very prompt management is necessary. So it can spread into the parapharyngeal space, retropharyngeal space, and it can cause even sepsis. Non-suppurative illnesses are distant infection, like you know that a group A beta hemolytic streptococci can cause a rheumatic fever, can cause a post-streptococcal glomerulonephritis, it can even cause a reactive arthritis or a late complication like possible pandas, which is a childhood and adult neuropsychiatric symptoms. Okay, So, this is possible in these children. And so, coming to the